Hello everyone and welcome. My name is Shay, and in today's lesson I will be talking about nutritional disorders. It is a tragic fact that we live in an age of scientific knowledge and advanced technology, yet people suffer with their health and a quality of life as a result of poverty, pollution, disaster, political, and even social factors.
When the choice of food is severely limited, as during a famine, illness and death on a large scale are the usual results. Many people in such countries receive little and often no food for long periods of time for a variety of reasons. As a result, they suffer from malnutrition and the effects of long-term starvation. Children in particular suffer badly as their requirements for nutrients are high. In such a situation, they may develop the condition PEM, protein, energy, malnutrition, also known as protein calorie malnutrition. PEM is caused by starvation and is more often seen in children than in adults. It is the disease that develops when protein intake or energy intake or both fail to meet the body's requirement for these nutrients.
At one time, it was thought that this condition resulted in a lack of protein in the diet.
Kwashiorkor, it is now known to be a poor adaptation to famine where total food intake is reduced and results in these symptoms such as retarded growth, chronic diarrhea and infections, deterioration of hair, skin, and nails, retention of fluid under the skin causing swelling, poor digestion of food. In adults, starvation results in a variety of symptoms including 1. Wasting of body tissue, 2. Wasting of muscles and organs such as the heart and intestines to a size where they are too small and weak to function properly. 3. Dryness of hair and skin. 4. Edema in the limbs and on the face. 5. Personality changes causing restlessness, indifference, hysteria, and severe moodiness. The treatment of starving people is difficult, not only because of lack of money and political reasons. Infections such as cholera and pneumonia often aggravate the plight of the starving, and the final cause of many is death.
Oh no!
An unbalanced diet, that is one containing too much fat or too much sugar, can result in a variety of chronic nutritional disorders such as
heart disease, obesity, tooth decay and gum disease, and intestinal diseases. Chronic diseases such as stroke, heart disease, diabetes, and cancer are the causes of most deaths in the Caribbean. In addition, an increasing proportion of adults are becoming obese. Thus, it is evident that obesity and non-communicable chronic diseases such as heart disease, stroke, hypertension, diabetes, and cancer have become major health problems in the countries of English-speaking Caribbean. Nutrition is the most important element in preventing and managing these chronic diseases.
heart disease is a major concern, and many research has gone into ways of preventing it and what causes it.
It has become clear that there is no single cause of heart disease. but many risk factors. Usually, causes of heart disease is brought on by more than one of these. Some of the risk factors can be prevented or reduced by changing habits or lifestyle, but some cannot. Risk factors that cannot be prevented are 1. Being male. More men than women have causes of heart disease, though it affects an increasing number of women. 2. Increase in age. 3. Hereditary. Heart disease often runs in families. Risk factors that can be prevented or reduced. 1. Smoking cigarettes, because this increases the risk. 2. Choice of food. Eating less fat and more fruit and vegetables can help prevent it. 3. Being overweight. 4. Lack of exercise. Regular exercise strengthens the heart muscles and make it work more efficiently. 5. Stress. People who are impatient, ambitious, competitive, tense, and anxious seem more likely to suffer from this disease than those who are calmer, less worried, and more relaxed. 6. High blood pressure. This makes the heart work harder and speeds up the blocking of arteries. The other risk factors listed above may cause high blood pressure as well.
Obesity can be caused by hormonal problems, but the major cause is usually eating too much food than the body needs.
The excess is stored as fat in the body. Years ago, it was considered desirable to be overweight because it indicated that a person was wealthy and could afford to live richly. This idea has now changed, and obesity is known to be undesirable and unhealthy because of the following reasons. 1. Obese people are more prone to heart disease, chest infections, varicose veins, hernias, high blood pressures, diabetes, gallstones, osteoarthritis of the back, knees, and hips, and skin infections. 2. Extra body fat can cause complications during operations. And 3. Unhappiness about being obese and comments made by other people may make an obese person turn to food for comfort, making their current situation or condition worse.
Oh no!
Many people feel that they need to lose weight and take action to do so. A great deal of money is spent on slimming aids and products by people trying to lose weight quickly and with the minimum effort. Some people who try to lose weight are not even obese or even overweight. Girls and women in particular may feel under pressure to conform to the sort of ideal body image they see in magazines and on television. A person who is trying to lose weight should seek advice from a doctor or dietitian to agree a weight-reducing diet that suits them. Weight loss takes time and requires changes to a person's eating habits and way of life, such as taking in more exercise. Willpower, determination, and an understanding of how food affects the body is needed. The most effective and healthy way to reduce weight is to take in slightly less energy from food that the body needs each day. The body then makes up the difference by releasing the energy it has stored in fat. Gradually, the stores of fat are reduced. Exercises using more energy will promote weight loss, tone the muscles, and generally help to make a person feel better.
There is no single cause for someone having eating disorders. Many factors can lead to having an eating disorder, which includes
emotional shock or grief, stress over a period of time, fear of growing up, an unhappy childhood, unhappiness about body size and shape, unhappy relationships within the family, a need to have control over one's life. People react very differently to these, so this list is only a guide. Treatment for eating disorders is usually long, and it is often not possible to say whether a patient have been cured. Patients often return to normal weight and eat regularly, but many slip back into habits of controlling what they eat if they come under pressure or are unhappy again. Special clinics dealing only with eating disorders offer expert help. Patients must want to be helped and cooperate with the treatment if it is to work. Treatment often includes the whole family to give them an understanding of the problem. Much patience and understanding is needed if the treatment is to have any chance of success.
We have come to the end of the lesson for today. I hope you would have learned something from it. And do remember, every day you learn, you grow. So keep learning and you'll keep growing. Bye for now.